Hello friends, today we will talk about time-based coding as per the latest A&M guideline changes. I will show you some examples as well. While doing the coding in A&M according to the time-based, so the time-based A&M outpatient coding 99202, 99205, 99211, 99215. These are the CPTs we use during coding the outpatient visits. As per the latest 2021 guidelines, 50% criteria is not mandatory for office or their outpatient services. 50% criteria is still mandatory for other E&M. So hope you have the knowledge, or if you don't have, then you will come to know that 50% criteria is not mandatory for coding A&M services, outpatient visit basically. So this video is all about the outpatient visits, the CPT 99202-205 and 99211-215. So I just want to make clear that when we have the time given in the report, and then in that case, how to code and what are the things that we need to check while coding the time-based services, right? So earlier we used to check whether along with the time spent by the physician, we must have the statement of 50% criteria and face-to-face, counseling and coordination statement. But now we don't need to check anything else. We just go with the time spent by the physician. So we have to, while coding the outpatient charts, we just, most of the time physician mentioned at the bottom of the report, obviously, just state that, this much I spent, for example, 30 or 50 minutes during this visit. So if there is a single, there is a MD and spent 50 or 60 minutes, then we will check 60 or 50 minutes, whatever the mention, then we will code accordingly. But you know, uh, uh, we also will check the component, right? So on the basis of component and on the basis of time, whichever gives us the higher level, we will code the A&M label accordingly, right? So basically sometimes it also happens that you will most of the time you will find that there are other apps also working with MD. So what are apps basically? App means advanced practice providers, right? For example, PA also work with MD, NP also works, CNM, CRNA, and fellow and resident also works with the MD, right? So when they work in, when a PA is also involved, when a NP is also involved, but a CRNA also involved, right? When a resident and fellow is also involved, in this A&M visits. So PA, NP, these are the apps basically. They also mention their time in the chart, and MD is also mention their time. So while if they time PA separately gives their time and MDs also separately give their time, then in that case we have a, sometimes we get confused that whether we should add the time of both MD and PA, or MD or NP, or MD or fellow, or MD or resident, whether we have to sum up the time or not, right? What will be the correct way? I'm just going to show you. First, I just want to explain you what are basically just shared or shared split time based A&M coding. Basically, a shared or a split visit is defined as a visit in which a physician and other qualified healthcare professional jointly provide the face-to-face and non-face-to-face work related to the visits. When time is being used to select the appropriate level of service for which time-based reporting of shared or split visit is allowed. The time personally spent by the physician and other qualified healthcare professional assessing and managing the patient on the date of encounter is summed to the defined total time. Only distinct time should be summed for shared or split visit. That is, when two or more individuals jointly meet to discuss the patient, only the time of one individual should be counted. I just will clear this confusion ahead, so just keep watching. And what is basically app? An advanced practice providers as the naming convention for non-physician direct care provider in the office setting. The categorization comprises physician assistant, like that we call PA in short, and advanced practice registered nurse, APRN, such as nurse practitioner, certified nurse practitioner, So these also work with the MD in the hospitals or sorry, in clinics, right? I'm just it's all about office visit or clinics. Apps have master degree. What are apps basically? Most of the time during the attestation at the bottom of the chart, you will see I have seen and examined the patient along with my app. So what is app basically? App may be PA, NP, CRNA, and resident and fellow as well, right? So app, what is app basically? Just to have brief about it, apps have master degree or higher. They are an important part of patient care team and work at hospitals, outpatient centers, doctor's office, emergency room, and urgent care centers, and in many different specialties, right? So this was something about app, and because of their advanced training, apps can do a lot of the same things as physician do. What they do, take patient histories. They can take patient histories, like PA can take patient history, NP can take patient history, fellow can take patient history, and a resident also do the same. Conduct physical examination, order lab work, deliver babies, and perform take pre-operative histories, conduct post-operative exams, help patient manage chronic conditions like diabetes and heart disease, make referrals to specialist or other services, act as assist during surgery. Nurse practitioner, physician assist, and nurse midwife can also practice medications sometime. Yes, your physician might introduce you. So this is very important things that you will make your confusion clear about apps. Your physician might introduce you to an app at an outpatient and ask if you would like to have future or follow-up appointment with him or her. Your app and physician will consult with you and each other about your care. So nationally, apps receive high patient satisfaction survey because they have very good practice with the patient. They are very much involved with the patient, so that's why they have very good and very sound experience working with patients, and they can understand them very well. Patient often say their app relates to them on the different level than their physicians, because many apps come from nursing or patient care background, right? That I already have mentioned. They tend to develop comfortable relationship with the patient quickly and easily. After seeing an app, patient frequently request future appointment with app for routine care. So hope now your confusion about the app wording has been clear. Now I just want to show you some scenario and just a brief, you can say a formula. So if at the end of the table, at the end of the chart, you see that the patient or the physician has mentioned physician and resident. So it's all about time. So if at the bottom of the ANM chart, if resident and fellow, mention their time, and along with that MD also has mentioned their time, right? So in that case, we will only code on the basis of time of MD. We will not take total no, we will not take the time of resident and fellow, right? Because resident and fellow cannot work independently. They work with the MD, but we cannot take their time to code ANM label, right? So if a resident mention their time or fellow mention their time and MD also mention their time, so we will code only on the basis of the MD, right? I will also show you the example. If you have a scenario where PA is when a PA is working as an app and MD is working there, no, PA is working under MD, you can say, right? So PA has given their time and MD also given their time. So we will add both the time and calculate accordingly. If NP is also has given the time and MD has also given the time, then we will add both the time and means NP time along with the MT time, and then we will code ANM label. If we have given the time of APRN and MD, both have given their separate individually, they have mentioned their time, whatever the time they devoted during the visit, then we will add time of both, like APRN time and MD time. We will add both and then code the ANM label accordingly. For example, time spent by resident and fellow, right? If we have a chart where resident or fellow is also involved and working with the MD, a resident and fellow, mention their time that they spend 30 minutes, right? And time is spent by MD. MD is also mentioned. No, at the end, at the bottom of the report, he mentioned that this is. I have seen the exam, seen the patient and examined the patient. So and spend 40 minutes during these visits. So we will only do not consider resident and fellows time to code, means we will not take the resident and fellow time, and we will only code on the basis of the time given by the MD, which is 40 minutes, right? Example 2, time spent by resident and fellow 30 minutes, time spent by MD 40 minutes. MD states we both spent 70 minutes. So, however, MD had mentioned that we both have spent 70 minutes, but we will code on the basis of only MD, because we will not take the time, or we will not take time of resident and fellow in order to calculate the ANM label on the basis of time, right? Third example is time spent by NP 40 minutes and time spent by MD 20 minutes. And in this case, as per the formula, we will add both of their time, like 40 and 20, 60 minutes, then code ENM label as per the 60 minutes. Now the last formula, last scenario example is time spent by PA. Means PA is also involved and MD is also involved. PA has mentioned their separate time, and MD has given their time. So both spent 45 minutes. So as per the formula, we will add both the time. So it's 30 and 15 minutes. So it's 45 minutes. Then we will code on the basis of the 45-minute ANM label. I hope now it should have been very much clear to all of you that whose time we have to add, and whose time we don't need to, or we cannot add, right? So resident and fellow, take care of it. If resident and fellow are giving their time, we will not add with the MD's time. Rest, like PA and P, we will add the time with the MD and then calculate the ENM table. Hope this will make you clear that how to code the time-based coding in ENM as per the latest guidelines. And I would if I would like to say that if you would like to have such you know useful information regarding the ANM changes on regular basis, then I would like to say that just subscribe my channel, like my channel, and share, and don't forget to press the bell icons to have some latest changes and my latest updates, right? So I would like to say thank you watching this video. Keep coding. Have a great day. Thank you so much.